Everybody knows about the risks of surgery, and one of the most feared risks of surgery is an infection, a post-surgical infection. This has been a problem since surgery began. All through the 1800s and 1900s, surgical site infections was always a big deal until they invented antibiotics. And when antibiotics were discovered, they decreased surgical site infections, but didn't eliminate them. Right now, surgeons prevent surgical site infections by giving intravenous antibiotics a half hour to an hour before surgery, and that does decrease the risk of surgical site infections. However, you can imagine that if you can put the antibiotic right where the incision is occurring at a concentration that is 50 times greater than they can achieve with intravenous delivery of that drug, and it stays there for 24 hours, which is about 24 times the length of time the antibiotic will stay there if it's given IV, the ultimate result is that you're going to prevent infections. So in our personal practice, we rarely have infections. This is just not heard of. Occasionally, someone will have an infection after they've stopped taking care of their wound at home. They let the dog lick it, or they just go surfing or whatever else, and they get an infection. But it's not a surgical site infection that we have to worry about very much. So we take all the precautions we need to and ought to take to prevent infection. But the local anesthetic and the combination of that with the antibiotics right where you want to prevent an infection are very powerful. No matter where the surgery is prospectively intended, we can inject local anesthetic and an antibiotic and an anti-inflammatory right at that site. And then the risk of infection is very, very small. If I wanted to prove that patients don't get an infection, that's trying to prove that something doesn't exist. And if there's a 15% chance of a surgical site infection, in order to do a clinical trial that would prove that, I would need somewhere around 400 to 500 patients to prove that it goes from 15% rate of infection to 5% rate of infection. That's a very significant improvement, but it takes a large number of patients, and I, as a little dermatologist, is never going to do that. On the other hand, I can show that if they use this local anesthetic technique, Tumescent drug delivery, the pain relief is universal. So they only need to do 10 patients and prove that this is no pain after surgery, no narcotics, etc. That's what I'm hoping that will happen soon, and that surgeons and anesthesiologists adopt this for pain relief. They'll also find that there is a dramatic decrease in surgical site infections.